Well, again, thank you very much for asking me to come and speak to something that is near and dear to my heart, our partnership between the University of Toronto and Addis Ababa University called TAAC. So just to give you a sense, we're going to start today to share a bit about the history of TAAC, kind of how we got started and what we do, some of the goals and objectives of the partnership, some of the guidelines and principles that we use as we do this work together, and then share with you a little bit about some of the current programs. Marjorie, if you can move us to the beginning slide, please. So TAAC was created in 2003. Marjorie, if you can you advance? Sorry, thank you very much. Always hard when someone else is moving your slides. TAAC was created in 2003, really as a multidisciplinary educational partnership between the University of Toronto and Addis Ababa University in Ethiopia, with the main objective to develop capacity and sustainability in medical and academic postgraduate training. At the time in Ethiopia and in many low and middle income countries, there was a terrible problem with brain drain. Over 90% of people who left Ethiopia to train in any kind of postgraduate training weren't coming back to Ethiopia, and they were really losing the best and the brightest, and a problem that the country was really struggling with. The desire to have a self-sufficient graduate training programs in Ethiopia was a real goal of Addis Ababa University, and a desire to build capacity and sustainability in country was identified by the government of Ethiopia and by the university. So how did we get started on this? Marjorie, if you can advance this slide for me, please. It was really a simple model that I'd like to say was critically analyzed and thought about, but in some ways I think it's probably safer to say it was a model that we stumbled upon. What we began with our first program, and we started really small, and I think that's probably an important point to make, is that international partnerships often start with relationships that build over time. And this is something that takes some time to do. But back in 2003, there were 78 million people living in Ethiopia. And there were about 6 psychiatrists in the entire country, and 2.5 faculty in the Department of Psychiatry at Addis Ababa University, 1 department in the entire country. And as I said, a terrible problem with brain drain. Folks from Addis Ababa University approached us at the University of Toronto. They were interested in starting a a residency training program. The idea is if we could train people in country, then maybe people wouldn't leave and we could build capacity within the country. And we started with this idea, bring 2 faculty and a senior learner to Ethiopia for a month at a time to train in country with pre-organized curriculum. And by doing this, we hoped that people would get the education they needed in the country and stay in country. And I will fast forward to today and then fill in the blanks as we go along. But with this model of in-country training, we talk about it as a bit of a bolus effect. We would bring faculty and a senior learner to Ethiopia. We would teach for a month. We would leave, and our Ethiopian colleagues would continue with their learning and their clinical work. And then we would come back for another month and continue with the training. By using this model with small pre-organized groups, different than some other international collaborations where you see, a dozen people who kind of embark upon the country or upon the hospital. We felt it was important to have small organized groups. We didn't want to push our Ethiopian colleagues out of the way. We wanted to make sure that there was an opportunity for dialogue and for work together. And it was important to keep our teams small so that we could embrace the voices of our Ethiopian colleagues. By doing this, where we would come repeatedly year after year, We now have increased the psychiatry complement in Ethiopia. There are over 120 psychiatrists from our small numbers at the beginning, almost all trained through our collaboration. The Department of Psychiatry went from 2.5 faculty to over 30. There are now 6 departments of psychiatry across the country, run by graduates of our program. So really having that kind of multiplier effect. And I think one of the most important things is that the retention rate of those trained in country is over 95%. So we've learned if you train people in country, if you can get the education you need, you're more likely to stay. And that's an important part of the work that we do. Early on, we realized that we needed to have an administrative structure that would support this kind of work. And we identified a point person or a lead, someone from the University of Toronto who would work with their counterpart at Addis Ababa University to identify what the teaching needs are. We would work with the approval of the dean or the chair from the University of Toronto, who is involved in our governance, and in areas where there was no specialists. So for example, family medicine and emergency medicine, where there were not physicians or those specialty areas, when there wasn't a nucleus of specialists, then someone from Addis Ababa University was identified and kind of appointed as the point person. When family medicine started at Addis Ababa University, there were no family doctors. A psychiatrist was kind of identified as the lead for family medicine until that first batch or cohort group of family doctors were trained. The idea being that once folks were trained, that the best and the brightest would become faculty at Addis Ababa University, and we would continue to increase our faculty and our skilled clinicians through this model. If you could move to the next slide, please. So we went from very small, as I said, for one training program, training psychiatrists. We did that for about 5 years. And after 5 years, Addis Ababa University approached us at the University of Toronto and said, we really like this model of collaboration. It's a gold standard. And they asked us if we would consider expanding to other postgraduate training programs using this small model of 1 month intensive in-country training in small, well-organized groups. Today, we have over 30 collaborative programs that are on site, and I'll share some of those with you at the end of the presentation. It's really a longitudinal model. Important for us that we don't fly in for a few days to teach a short course of some sort. We really teach into curriculum, and I'll talk about how that works in a few moments. Before COVID, we were sending almost 100 volunteers the University of Toronto to Addis for a month at a time. We are ramping back up over the last number of years, but working to get back to that 100 volunteers in a year. Marci, can you, the next slide, please. So what are some of the goals and objectives that we have? In some ways, they're pretty simple. Capacity building. And the capacity building, often people will approach, they hear about our collaboration at the University of Toronto and they say, oh, I'm really interested in, I'd love to go to Ethiopia and teach in their particular area of interest. But it just doesn't work that way. The programs are driven and requested by Addis Ababa University. It's not what can we do there, it's what are the needs in Ethiopia. And those needs are identified by our Ethiopian colleagues. They're brought to myself and my counterpart, Dr. Dowett, who is our Ethiopian lead. And we really work in accordance with the needs for targeting an increased number of graduates. Those graduate programs are identified by the government of Ethiopia, by Addis Ababa University, and by the College of Health Sciences. And TAAC really works to co-develop local capacity and sustainability in essential medical and graduate and academic programs at Addis Ababa University. The objective is to really enable Ethiopians to acquire the specialized training in country as practicing professionals, as well as to populate the university with well-trained faculty. And our graduates go on to become faculty at Addis Ababa University and oftentimes in the universities outside of Addis. Addis Ababa University is really considered a feeder university for the many universities that have cropped up in Ethiopia since 2003 when we started. There were about 4 universities. Now there are over 50 universities in Ethiopia, all looking for faculty to teach their students. It's important for us to support AAU's vision. This is not what is U of T's vision, but this is what is Addis Ababa's vision. And their vision really is to become one of the top universities in Africa. They would like to become a magnet for post-secondary education in sub-Saharan Africa and to become internationally significant in the research endeavors that are happening at the university. We also really try hard to work to benefit mutually in the learning that happens and to develop culturally sensitive educational and partnership skill sets to promote cross-cultural learning for the University of Toronto and for Addis Ababa University. Frequently, people talk about what they hope to give, a word that I think has so many meanings, but what do they hope when they go to Ethiopia to give to the university there? And what we hear from our faculty is how much they get out of that experience, how much they learn, how much our faculty here think differently and critically make decisions in a way that they hadn't before spending time in Ethiopia. So it is really bi-directional learning. And I think that's an important value as part of our partnership. Marjorie, if you can go to the next slide, please. So we do have some important guidelines. We don't have a lot of them, but the ones we have, I think, are really kind of baked into the principles. One of them, and one of the most important ones, is that the curriculum is overseen and owned by our Ethiopian colleagues. We're not exporting curriculum. Ethiopia is one of the few countries in Africa that was never colonized, and it's an important point for us to know that we're not trying to make U of T doctors in Ethiopia, but we are using Ethiopian created curriculum that we are involved with, and that the request will come to us to teach a particular area, and we work with our Ethiopian colleagues to make sure that the curriculum is culturally relevant, that it is culturally sensitive, that it's contextually appropriate for our Ethiopian colleagues. Another important point for us is that academic authorship is for work that we do, and folks on this call will probably have had a similar experience that I have had, where I will see an article about some work that has happened in Ethiopia, and I look to see at the authors, and there's maybe one Ethiopian author and 14 North American or European authors on a article. And I always think to myself, how in the world did those folks manage to do work without involving our Ethiopian colleagues? They obviously didn't. And it's really important to us that we have equal authorship and credit for the work that we do, that if there's 2 Ethiopian authors, that there's 2 North American or Canadian authors on that. The other piece around the authorship, which is important, a paper that we wrote, which is called Stuck in the Middle. And those in academia will know that first and last authorship spot those are the coveted spots, the most important and meaningful spots often in academic publications. And we want to ensure that those first and last spots are shared with our Ethiopian colleagues, that they're not stuck in the middle of a dozen North American colleagues. So we work really hard to ensure that the authorship on academic papers, on presentations, on the work that we do is jointly done, co-shared and co-authored. Next slide, please. The other thing that we think about, and I think this speaks a little bit to this idea of kind of cultural humility, is that the University of Toronto faculty are invited guests. We are not there to fix or solve problems that our Ethiopian colleagues are well aware of, but we're there as a guest. Kind of like when you go to someone's home, you're a guest. You sit in their sitting room. You don't go into their bathroom and run through their medicine cabinet, or at least I hope you don't. And in this case, we're there as an invited guest to partner with our Ethiopian colleagues and to make sure that their perspectives are heard and amplified. And it's an important, I think, probably as Canadians, we are good guests, and part of why our colleagues in Ethiopia enjoy partnering with us. We also need to think critically about some of the positive and negative or unintended consequences of the work that we do with our colleagues in Ethiopia. We're often seen as experts, even in areas that we aren't. When folks see clinicians and faculty from the West or from Canada, we're often seen as having skills that we don't necessarily have. So we need to be cautious and careful about the positive effects that we have, and also some of the assumptions that our Ethiopian colleagues and that we ourselves make. And I've quoted a couple of papers here where we've done some work in this area. Next slide, please. So these are some of our really important, I think, guiding principles, some of the values of TAAC. There aren't a lot of them, but they are really kind of core to our work. Solidarity and teamwork is of the utmost importance, and it is essential between the TAAC collaborators, both at the University of Toronto and at Addis Ababa University. And these principles are really best achieved through frequent dialogue and interaction to reach consensus and consistency in all the work that we do with TAAC. International collaborations are not easy, and it's important for us to have good dialogue, to discuss areas where there's conflict or there isn't consensus, and to continue to have open and honest conversations, to be culturally sensitive, to have cultural humility and safety, and recognizing that there's huge differences in the context in Canada and in Ethiopia, that access to material resources, beliefs and expectations between our partners, and that there's really ongoing work that we need to do together with our Ethiopian colleagues in leadership to ensure that both parties feel safe, feel that they can have open and honest dialogue. And this is really strengthened by being alert to educational colonialization, a philosophy of self-reflection, mandatory pre-departure training. We make sure that all faculty, before they leave to go to Ethiopia, are involved in a central briefing which addresses issues of culture, of context, of health and safety. There's orientation and briefing that happens in each programmatic area, and the participating faculty and learners are debriefed when they return back to Canada as well. We really put a strong emphasis on ethical integrity, and it makes sure that all people who are associated with TAAC act in good faith with intellectual honesty and fairness, really each taking into account and responsibility for their own actions and decisions and consequences. Mutual respect is really a very important part of the work that we do. And it's based on really a shared belief in the benefits of diversity, of valuing the many different backgrounds, the abilities, and the viewpoints within TAAC, and an outlook beyond the differences to optimize trust and appreciation. And I would say that the mutual respect includes encouraging mutual and collaborative learning between the University of Toronto and Addis Ababa University, respecting the values, the habits, and the beliefs, both at AAU and U of T, supporting and upholding the decisions of legitimate authorities. Ethiopia is a country with a strong and old culture with hierarchy, and we need to make sure that we follow the rules and regulations at Addis Ababa University. They may not be the same as the rules and regulations at the University of Toronto, but it goes back to this idea of being an invited guest. And we are there as a guest to follow the rules that are set by the university there. We implement intent with a real intent for the policies that are currently there, while at the same time trying to respect the systems and the structures that are in place at Addis Ababa University, recognizing that there are many limitations, but there are limitations here in Toronto as well. And we think about transparency and accountability for TAAC principles and priorities. That includes programmatic integrity and is managed such that information is readily available and well communicated, or at least we hope so, for all who are involved in TAAC. The next slide, Marjorie. So these are some of the principles, again, that we have found are important for TAAC, and things that really have evolved over time. And I think this is our partnership, which has been going for over 20 years, has shown that things have started from transactional to relational. At the beginning, we were there to teach, and we still continue to do that. But it's not transactional in the same kind of way the work that we do now is relational, and these relationships are built over time and are an important part of the work that we do. We've gone from really looking at outputs to looking at the process. It's difficult at the beginning. It's very tempting just to count things as an output. We've trained this many people, we've sent this many people. This is the numbers that have grown. And although those metrics are very important, what's even more important is the process to get to where we are now. And we see that as the partnership evolves. And really mutual respect for the work that we do. It's truth we often talk about is relative, and often we think about, we don't want to get pulled into this is the best way to do something. But what is the thinking that underlies the practice that we have in Ethiopia? There's often a very good reason that underlies a practice or a principle or a way that something is done. And until we have this mutual respect, till we have the dialogue, we may not appreciate why something happens. And that's constant dialogue, constant conversation, respect and transparency allows us to continue to advance the work that we do together. The next slide, please. We've gone from looking at value to looking at our values. And although that's just a change of one letter in the word, it's an important change, not just value, but our mutual values. And from looking at equality to equity, things will never be exactly equal. What the University of Toronto gets from this partnership, what Addis Ababa University gets from the partnership, the systems, the structures, they're not equal. The material resources, but we really try to look at moving from equality to equity. The next slide, please. Early on in the partnership, a lot of time is spent on problem solving. It's very tempting for our colleagues here in Toronto to try to solve the problems when that they identify when they get to Ethiopia. That's not our role. That's not our job. We're not there to solve a problem. Our Ethiopian colleagues are well aware of many of the problems and limitations in Ethiopia, but we really look at trying to co-create things together to solve these problems as a group. And instead of this idea of I'm going to do it for them, but how can we do this together to advance the work that we're doing? And we find it's much more rewarding for everyone when we can go from an area or from a mindset of, let me do this, let me help you, a very colonial approach, to how can we do this work together to advance both of our goals and our learnings. The next slide, please. So with the backdrop of these principles of co-creation, of academic ownership by our Ethiopian colleagues, by cultural humility and transparency, and lots of dialogue and lots of conversation, we've been able to move from working in just the area of psychiatry to expanding our work into many other areas at Addis Ababa University. As I said before, these requests come from Addis Ababa University. This isn't something that the University of Toronto kind of hatches, but the requests come from AAU. And currently we have moved to many new partnerships from our sole partnership in psychiatry. We now have programs in critical care medicine, in a number of areas in our Department of Medicine here at the University of Toronto. And it's worth saying that for the most part, these are all firsts, fellowships in hematology and gastroenterology, endocrinology, with the work that we're doing now. With the MasterCard Foundation, we've been able to expand some observerships in cardiology and nephrology and neurology. We have a palliative medicine fellow here right now. She will be the first fully trained palliative medicine physician in the entire country when she finishes her year here in Toronto, and observerships in infectious disease. We do bring folks to the University of Toronto. One of the things that's important at Addis Ababa University is that learners do have an opportunity for a short international attachment. And we certainly work hard to not contribute to the brain drain. So when folks do come to Toronto for short attachments, they're short, they're well curated with specific learning goals. I used to joke we would bring people for short attachments in the middle of the winter here in Toronto when the weather is horrible and we want to make sure nobody will stay. But that's not entirely true. But we do want to ensure that when our folks come to Toronto, that they're here for a learning opportunity that's relevant. It's interesting if you're a cardiologist to come here and see some of the very fancy and sophisticated work that is happening in some of our advanced cardiac centers in Toronto. But in fact, that's probably something that's not going to happen in Ethiopia for many, many, many years. So to come here to see multiple transplant kinds of work, again, not particularly relevant. We want to ensure that when folks are here, it's meaningful. They can take that learning, bring it back to Ethiopia, and integrate that into the healthcare system in Ethiopia. Next slide, please. We also have programs in emergency medicine. Again, that was the first in the country, a very exciting, robust partnership that is celebrating some huge milestones. We have work in medical imaging and a number of fellowships in subspecialty areas in radiology, work in surgery. Department of Family and Community Medicine is another important program as Ethiopia works to have family physicians in primary care across the country. There's work that's happening in ophthalmology with a pediatric fellowship in pediatric ophthalmology. Our radiation oncology folks are doing some really interesting work in not only radiation oncology, but in medical physics, looking at some work in fellowship in breast cancer and other subspecialty areas that fall under that umbrella. The next slide, please. Speech language therapy is an area we've just had the first batch of master's trained speech language therapists in the country, just graduated a couple of weeks ago. Introduction to a brand new profession in the country, very exciting time for these young clinicians. Psychiatry, which I have spoken about, there's now a master's in clinical psychology, which is new to the country, as well as a fellowship in child and adolescent psychiatry. Important area because of the 120 million people who live in Ethiopia. Almost half the population is under the age of 15. So work in child and adolescence is very important as well. We're doing work in pharmacy and social work. Our dentistry partnership is one of the few partnerships in undergraduate education, but important to train general dentists and specialists in Ethiopia as well. We are working to start a new partnership in nutrition and dietetics. Clinical nutrition embedded into the hospital system in Ethiopia is a goal of our colleagues in Ethiopia, and we're hoping to support training in that area as well. We had a partnership a number of years ago in nursing, and we are now re-engaging with critical care and emergency nursing, with teams going to teach on the ground this fall, which is quite exciting. And some work in supervising PhD students in applied science and engineering. Next slide. Those are our partnerships, and a little bit about kind of how we have created our model for TAAC. In some ways, it's a very simple model. We do our best to take the best and the brightest from the University of Toronto and train those who will become the best and the brightest at Addis Ababa University. In some ways, I often talk about us being supply teachers or substitute teachers, a term that's used here in North America. We're there to teach where Addis Ababa University doesn't have faculty, and try really to help build faculty and capacity in country. I will say Amasaganello or thank you in Amharic. Those of you probably on this call will be familiar with Nelson Mandela's very, I think, powerful comment about education really is the way to change the world. And Marjorie, you can move to that last slide there. I will show you in Amharic, and those who are Ethiopian on this call, I will apologize for my less than perfect Amharic, but what you see there is Der Biber and Basa Yasar, which means together a spider's web will tie a lion. And it's comes from an Ethiopian proverb, and I think it's important because if you think about a spider's web, it becomes more intricate as you have more partnerships of it, as you have more collaborations. For us, it becomes a strong foundation that will be able to kind of harness a lion. And I think of our partnership as a spider's web where we work together to jointly be able to tie that lion. So I think I will stop there. I'm happy to answer questions and to go back, and very hard to do this on a Zoom call or a Zoom presentation. I would love to have some dialogue with those who are on this call today. Thank you.